Hi, I'm Katie Calkin, Community Health Educator with Piedmont Athens Regional. Welcome back to session 2 of Courage to Quit. Here's my contact information if we haven't already been in touch. Happy to work with you on action steps and send you a booklet for each session of the Courage to Quit. So this is session 2. We're going to talk about withdrawal symptoms, cravings, making a quit plan, all the different pieces that go into that. We'll talk about an action step for the week. And as always, we'll do some guided relaxation to support our brain in quitting. So it can help to think about withdrawal symptoms as recovery symptoms, not in a Pollyanna way, like everything's okay, because these are significant things to go through, but it can help to think that this is your body detoxing from nicotine and moving towards a healthier state, and it will pass. Usually 3 days to 3 weeks for people for these physical, mental, and emotional symptoms of withdrawal. If something lasts longer than that, for example, anxiety or depression, that lets you know that was an underlying condition that you had before, and you might have been using nicotine to help cope with that. And that's something you definitely want to talk to your healthcare provider about. So let's take a look at some of those common withdrawals. Cravings, we'll come back to talking about that in a few minutes. So that's where your mind is really focused on getting that nicotine because you're getting that physical craving. Your brain is wanting to get that dopamine and adrenaline again. Coughing and dry mouth are common. We have little hairs in our nose and our airway, cilia, and those cilia are paralyzed by nicotine. So when you wake up in the morning, you might have more of a cough than usual. When you go longer than usual in between using nicotine, then you might notice that you cough. And when you quit, you often cough more. Again, that's short term. And if you think about this is my body releasing some of the things that have been stored in my airway, and it will calm down. Sometimes that can help. And so you want to keep cough drops, water, lozenges around to help with that. Being lightheaded, less concentration and tingling in hands and feet. All of those things have to do with you having more oxygen in your system than you're used to. So you're used to having a higher level of poisonous carbon monoxide and a lower level of oxygen. When you get to a normal level of oxygen, it can actually feel worse at first, but then your thinking will become more clear. You're going to be getting adjusted to better circulation out in your hands and feet, and it will feel better. But again, sometimes it takes a few days to a few weeks to get to that state. So nicotine is an appetite suppressant. So sometimes people are hungrier when they quit nicotine at first. And it doesn't mean that you need to eat more, but it does mean you might need to eat more often. So you might need to eat your meals and snacks closer together. So you might be used to going longer amounts of time and not getting hungry because your blood sugar is raised a little bit by nicotine, which suppresses the appetite. So you might need to eat a little more frequently. Doesn't mean you need to add amount of food, just getting it more often. And sometimes if people are replacing nicotine with food, then they can gain weight. So you want to be really careful when we look at your quit plan, how you're going to cope with your triggers, that you're not substituting smoking, vaping, smokeless tobacco with food every time. Constipation can happen. Withdrawing from nicotine can slow bowel movements. And so if that happens to you, just remember that's normal. So exercise, drinking water, high fiber foods can help with that. Withdrawing from nicotine can disrupt your sleep patterns for a little bit. Usually people sleep better than ever once they get through those first few weeks, but it can feel kind of wonky at first. So irritability and short temper are really common side effects when withdrawing from drugs, including nicotine. The problem is that oftentimes you may have dealt with irritability or being short-tempered, cranky by using nicotine. So now you have an increase in irritability and you've taken away the way that you're used to coping. So it's really important. We talked about life work in class 1. It's really important you're doing that life work. How are you dealing with the things that are stressful in your life without nicotine? You really want to be practicing those. You also want to give yourself some space to not be your best self for a few weeks. And you want to ask people in your life to give you some space to not be your best self, for them to understand that you may have a bit of a different disposition. Your mood might be more challenging for you to regulate for a little while, but that is worth it because you'll come out on the other side better than ever. And then boredom is really common. We talked last time about how nicotine can be a companion. It can fill those bored, lonely spaces. So having hobbies, having connections to positive people, things that engage your mind are really important pieces to build into your quit plan. Sometimes people can really get narrowly focused on nicotine, can really be obsessing with missing it. If that's true for you, what we talked about in class one as an action step is thinking about what you want for your life. So not why you need to quit, have to quit, should quit, but why you want to quit for you. That is can be a good antidote to obsessive thoughts, those repetitive, compulsive thoughts that you can get trapped in those loops. So really refocusing on what you want for your life, why you're quitting, what future you're building for you, and what that looks like. Again, you can write about it, visualize it, verbalize it, put reminders around. Obsession can be part of grief too, and you can feel the other pieces of grief. You can feel sorrow, anger, loneliness is a common response. As again, this may have been a really long-term relationship. This might be a really long-term companion in your life. So it's important to honor any feelings that you have because feelings they just are, they're arising. And you want to honor what you're experiencing and let it be, but you also want to let them move on in their own time. You don't want to hang on to them. You don't want to tell stories over and over. You don't want to romanticize using nicotine. You're quitting because you want to quit. So people who think about the good old days and get stuck into thinking about how great nicotine was in their life, they're probably going to go back to using nicotine. So you want to honor your grief, but be really clear that you're willing to go through the grief to get to where you want to be. And the last one is fear. It's really common. The brain tries to protect us. It throws out thoughts like, you might not be able to quit. Do you know how to live without nicotine? What if you have to tell people that you tried to quit and you didn't? What if you are successful? Will you even be happy without it? So the brain tries to throw out a lot of different things to protect you from this change that you're trying to make, to kind of stop you and keep you in what it knows for so long, keep you in your comfortable habits and thought patterns. So it's really important to recognize, name those fears. Just say that I am feeling fear about XYZ, whatever that is, and then get busy doing something else or practice some deep breathing to help calm the brain, but not to get stuck in thinking over and over and over about those fears. Again, if it feels like you can't escape from the fears, then that may be a sign of underlying depression or anxiety. So that's something to talk to your healthcare provider about if it's not easy for you to move away from those fearful thoughts. Then you may be having a brain chemistry thing that's underlying making that harder. So you might have some other withdrawal recovery symptoms. Whatever's true for you, just know that it will pass. And sometimes it shows you where your life work is, where the things that you need to put some energy into are. So when you're having those cravings, and that again is physical and also mental, you start to focus on that. One good strategy is to delay for 10 minutes. When you have a physical craving, it lasts for about 4 minutes. That's been shown in inpatient studies. And so if you wait 10 minutes, then you're making a conscious decision about whether to use nicotine or not, rather than giving into an impulsive reaction. So you want to delay. Now, 10 minutes is a long time if you're just looking at the clock. So you want to do something else. So get engaged, distract yourself with something else. Or there's an alternative of using mindfulness techniques to really stay with the present and ride it out. We'll come back to that idea in class 4. But for now, delaying, doing something else, getting distracted by something, doing some deep breathing, releases some dopamine, which is a mood lift, part of what you're looking for from nicotine, but also just helps calm your body and your brain. Also lights up the frontal cortex of the brain. That's the decision-making part of your brain. That's the part of your brain that says, I'm going to wait 10 minutes. I'm going to decide if I want to quit. I'm in charge. I have the power here, not this craving. So doing some deep breathing can help. And your body's going through a lot of detox. So drinking some water, that sipping motion, especially if you smoke or vape, that sipping motion can feel good. And you're helping your kidneys to detox, to release stored nicotine collected in the bloodstream and release it through the kidneys. So drinking water. So there's also 4 R's for cravings. Reframing, rewarding after, recognizing your accomplishment. And I'm going to show you some examples. They're just examples. And if you email me or call me and get the booklet, these will be written out, so you don't have to remember all of this. And these examples you can change to make right for you. This is just to get you started and thinking about it. So for reframing, you want to use some perspective taking statements, and those engage the frontal cortex of the brain. That's your executive function. It decreases activity in the amygdala. That's the part of the brain that is the freak out stress response part of the brain. So it's really changing the way the brain is working, and this has been shown in MRI studies to use reframing statements, and they help reduce the intensity of cravings. So simple things. This craving will pass. That gives perspective. I'm not stuck in this forever. This is hard, but it's worth it. Again, if you've worked on why you want to quit, that taps into that deep inner motivation. If I don't smoke now, I'll feel, you could fill in the blank with whatever emotion. I'll feel proud. I'll feel relaxed in a few minutes. And what would I tell a friend to do? Because often we're hard on ourselves, but if you think, how would I support a friend in this situation? That can help to talk to ourselves in that same kind of supportive way. So reframing statements. And then rewarding. So when we anticipate and savor something else, it helps to reduce the cravings for nicotine. So we're diverting that to something else. And you want to make those rewards incompatible with using nicotine if possible. So something that breaks your rituals, your habits, something that's new, different, completely different setting, or you're just switching it around so that it doesn't increase the nicotine craving. You want to space those rewards out slowly over time, and eventually the satisfaction of not using nicotine becomes its own reward over time. So some examples. Next time I have a craving, I will work in my garden for 15 minutes. That was an example from someone who never smoked in their garden, so it didn't intensify their craving, got their hands busy, got their brain busy, and it was joyful, felt good to them. During my worst craving after lunch, I'll have some frozen grapes. That was someone who used chewing tobacco, and so having the frozen grapes in his mouth really helped keep his mouth busy, and he enjoyed the flavor of them. So it was positive. You want to make some of those rewards after you don't use nicotine. So the brain's reward system creates those behavior ruts, those really fast habit patterns. And to create new habit patterns, you want to have some rewards that follow your new behavior. So you want to do something different and reward yourself for making the different choice. Doesn't have to be something you buy or consume, can be simple experiences. So after 10 minutes of not smoking, doing that delay, I will fill in the blank, something that is a positive thing for you. After not vaping today, like for going a whole day, I will. And how are you going to reward for that? Again, it doesn't have to be something you spend money on. And then the last R is to recognize accomplishments. So you want to reinforce the changes you're making with simple statements and focus again on what you're gaining. We mentioned in the first class that gain mindset is more motivating than a loss mindset. So what are you getting from this? So example, I'm building skills, I'm meeting my goals, I feel blank, feeling something positive about myself. These are all just examples to get you thinking. You want to make these meaningful for your life. If you're not sure, you want to talk through those, we can do that. Zoom, phone, email, happy to work with you on that. So when you're looking at making a quit plan, it can help to pick a quit date or make a plan to progress towards a quit date. And that might include your delaying or your tapering as part of that. You want to decide if you're going to use nicotine replacement therapy, patch gum, lozenge. Are you going to have medication support, Chantix, Zyban, Wellbutrin? And talking to a healthcare provider about that. It really helps to make your environment nicotine free. So if someone walked into your workspace, you got into your car, went into your house, they wouldn't know you use nicotine. They wouldn't see the paraphernalia around. They wouldn't smell it. They wouldn't see stains from it, like you've cleaned it up. And that reduces cravings, because if you see if you see a cigarette lying around, if you're a smoker, then you have that's an instant trigger. If you keep your vape pen because you think, maybe I'll use it in the future, we'll talk about that kind of mindset in class 4. That's going to be an instant craving when you see that trigger. So you want to try to make things nicotine free. Sometimes that involves paying some money for cleaning things up. Sometimes people even get their teeth cleaned, or sometimes this is just putting some energy and effort. Sometimes people will really rearrange things, rearrange rooms, furniture. Sometimes people will redo outdoor areas where they used to smoke. Sometimes people will put up a bird feeder or make a koi pond or something really different that marks that this is no longer a place where they use nicotine. You want to plan for your triggers. So you might have done that as an action step after session 1, where you really wrote down all of your triggers. And then there's a place in the booklet that if you get in touch with me, I'll send you, where you can write those down and then write down what you're going to do instead. I'll give you some examples in a moment. Make sure you have things in place for your cravings, triggers, your new habits, hobbies. Clarify your motivation. I keep coming back to that, but if you know why you want to quit for you, you're more likely to quit and stay quit. Decide on support. Who are you going to tell, and how can they support you? And let them know how they can support you. So don't assume they're going to support you in the way that you want. So maybe you just want someone to check in with you once a day, or you don't want them to check in at all. You want to call them if you need them, but they're texting you every hour, calling you a couple times a day, and they're bugging you, but it's not their fault. They're trying to support you in the way that they know best. So let people know how to support you if you choose to tell them. And then it's good to plan celebrations. So that might be the first few hours of being quit. It might be a day, it might be a week, a month. You might save money up to do something special, or you might just have simple experiences that mark your pride and your accomplishment, and reinforce that this feels good, that you're meeting your goals. So again, the booklet has this written out where you can write out a plan, you can fill in the blanks, and you can add other components that are meaningful for you. These are just tend to be the things that are help most people, but you might have some things that you add on your own, and that's wonderful. So when you're looking at the trigger section, that's really important. This is where a lot of life work is. Again, just examples, figure out what works for you. You might change your routine. An example of that is brushing your teeth after you've eaten. You might avoid the trigger. An example of that is taking a walk on your work break instead of going to the smoking vaping area. You might substitute for nicotine. So using a cinnamon stick if you have a hand-to-mouth habit, or a straw. You might find other ways to deal with stress. We'll come back to that in session 3. So deep breathing is a common example for that. And you might find rewards other than nicotine. So listening to music is something people often will say it's just a free thing they can do to relax. Can be anything at all that feels rewarding, feels joyful, is positive. So for your action step, working on a quit plan. If you're not ready to set a quit date, you don't need to. This is not meant to be anxiety producing, but you can start to kind of map out a plan for progressing towards your quit date. You might include tapering, delaying. You might have some nicotine-free times or zones in your life, like I'm not going to smoke in my car anymore. I'm not going to smoke inside. I'm going to move to outside. Can look so many different ways. There's no right or wrong. You do want to give a lot of attention to that triggers section. Again, be in touch with me if you want to get the booklet for that. If you want to talk through your quit plan, then I'm happy to do that over Zoom, phone, or email. And now let's do a guided relaxation together. And again, this is one of the things that can help. Deep breathing for our triggers can really, for our cravings, can really help reduce cravings. So last week we did that fingertip breathing. Today we're going to do a tense and release because it can sometimes be hard if you're feeling stressed to just sit down and do some deep breathing. So we're going to add tension to our bodies, and when we release it, then those muscles can be in a more relaxed state than they were at the beginning. So soften your gaze, or if it's comfortable, close your eyes and first just check and notice where your breath is. I've been talking really fast and it's awkward talking in the camera, so I feel my breath just in my chest. So I'm inviting that breath to move down to my belly by just relaxing those muscles, not forcing, but just kind of creating some ease there. Now keep breathing. Pull your toes up towards your shins so you feel that tension in your feet. Feel that tension in your lower legs so your calf muscles are tight. Then squeeze the muscles of your upper legs, your glutes, so your whole lower body is held as tightly as possible. So continue to breathe, but squeeze those muscles tightly. And then take a big breath in through your nose, long breath out through your mouth like a sigh, and release those muscles. So feel your weight sink into the chair. Any remaining tension drains down through the soles of your feet. And your legs just feel at ease. Leave your lower body as it is. Make fists with your hands. Run that tension up forearms, upper arms. So you're squeezing the muscles of your hands and arms. Bring your shoulders up by your ears. Feel that tension in your chest, your upper back. Keep breathing. Squeeze, squeeze, squeeze. Take a big breath in. Long breath out. Let all those muscles go. Relax your hands in your lap. Your exhales invite your shoulder blades to melt down your back. And tension drains out of your arms like sand pouring out of a sack. Belly moves softly, easy with each breath. Constriction in your chest melts away with your exhales. And leaving your body as it is. Scrunch your eyes shut tightly, crinkle your nose, purse your lips, hold the skin of your face and scalp tightly. Squeeze, squeeze, squeeze. Good breath in. And release it with that sigh. Forehead smooths out. Muscles in between the eyebrows release. Tiny little muscles of the eyelids can be completely at ease. Soften around the eyes, cheeks, jaw. Let your bottom teeth float. Next breath out, soften skin of face and scalp even more. Now just scan your body from head to foot. Notice if you've added any tension back in. Sometimes we have habitual places that we hold tightly. And with your exhales, invite those places to melt again. So your breaths out, soften and ease those areas. Rest the attention of your mind on your breath for a few cycles. Take a big breath in, like your whole body can breathe. Long breath out, everything getting softer, easier. Do that 2 more times. And after your third exhale, if your eyes are closed, you can open. Hope that felt good for your body and your brain. Be in touch with me if you'd like the booklet chapter, if you'd like to talk through anything. And when you're ready, you can begin session 3 of Courage to Quit. Take care.